Greetings, everyone. This is part one of a three-part series that we will be doing for our Wolfpack morning meetings with Dr. Michelle Nace. And in this part, she will be talking about how does the vaccine work and how do we know it is safe? Just tell us, give for the viewing public, what do you do here in Fairbanks? Where are you? How long have you been in your role that you're in?
Sure. I am Michelle Nace. I'm a pediatrician in Fairbanks. I work at Fairbanks Memorial Hospital in the inpatient unit, and I also work in the outpatient at Tanana Valley Clinic. I've been doing it. I'm in my 25th year. I graduated from Lathrop, but my kids all graduated from West Valley, and I'm more than excited to be helping the school district this year with just kind of processing the whole COVID-19 and experience as well as decisions that are being made.
Awesome. Yes. So that is actually one of our morning meeting questions is where did you go to high school? So good to know that you're a Malamute. Totally okay. We have lots of Malamutes here. I'm going to ask you one more fun question before we get started. Fred Meyer or Safeway?
Fred.
Okay. Yeah, no, it's okay. We understand. I talk all the time about how my kids hate me going into Fred Meyer because they're like, don't speak to anyone.
Yes, exactly.
Okay, so Dr. Nace is actually going to be she's going to do a three-part series, I called it today, on the COVID-19 vaccine. So she's our guest today, she's going to be our guest tomorrow, and she's going to be our guest on Friday. And then we'll have some fun little YouTube videos to share talking about the COVID-19 vaccine. But today, she's going to talk specifically about how this vaccine works and then how it got approved so quickly. So I'm going to turn it over to you, Dr. Nace.
Okay, so there's a whole bunch of different parts of this. So what we had to do is divide it up. So there'll be more message and more information to come about the vaccine. But today I'm going to try to consolidate and talk about this whole messenger RNA vaccine and how does it work. So for those of you can see, there's a picture of coronavirus. For those of you who are not, picture coronavirus as a circle with a whole bunch of little spiky proteins on the outside. So these spiky proteins are proteins that our immune system recognizes unfamiliar to us and used to fight against it from our immune system. So I want you to think of this virus as having inside an instruction manual. And that instruction manual, it tells the virus how to make itself. So our scientists were able to reach in to that instruction manual and tear out just one page. And that one page was how to make spiky protein parts in a messenger RNA format. So then they were able to translate this messenger RNA instructions into a form that our cells could understand how to make these spike proteins. Then they were able to figure out how to wrap this messenger RNA in a special coating, kind of like an M&M, a special coating so it could get into our cells, not our nucleus, but the outside part of our cells. So the cells get this message and they read this instruction. And then they get rid of the messenger RNA because they've read the instructions, they don't need it anymore. And they start to do what it's told, which is make these spiky proteins and put them on your cell surface. So the cells do this, and now they kind of look like coronavirus. So then they're in our system, and then the immune system comes by and goes, hey, what are these spiky proteins? That's not our normal protein. We got to clear that out of them. So then our body goes through this process of getting ready to do just that. This is the immune reaction where we might feel like fever, headache, fatigue, some achy joints or muscles or tenderness at the site where we got the vaccine because our body's going under project, clear out these spiky proteins and remember what they look like in case they ever come back again. So part of our immune system is working to clear this spiky proteins out of there. And part of it is working on to remember what these spiky proteins, so if any more come around, we are ready. So we have antibodies and cells that are their job is to remember the spiky protein. So we are ready with the tools. And as we know, coronavirus has these spiky proteins. So when they come and enter our body, we have the upper hand to be able to fight this. So shot one that you gets things started and gets the immune soldiers ready to fight. And then shot two, you might get 3 weeks or 4 weeks, depending on the vaccine later. That is changing our immune soldiers into like an immune army. So we are more ready if the real virus does come into our body. But wanting to remember the points that by using this messenger RNA method, no virus enters your body. You cannot get the virus because we only have one page of instructions, the spiky proteins. And that messenger RNA instruction is super fragile. The cells just get rid of it. It just goes away after they read an instruction. It doesn't become a permanent part of our body. So that mRNA's special coding only allows it to get in that outer part of the cell. It can't get into the nucleus. And the nucleus of the cell, the brain of the cell, that's where our DNA and our genetic material is stored. And messenger RNA cannot get in there. What we don't know is how long is this going to last? Is it going to last for months, for a year, for years to come? We don't know the answer to that, but we have time to figure that out. If we do find that over time, immune systems are waning, then we'll get booster doses, similar to how we do with like the tetanus vaccine, how you have to get that one in the years to come. So go ahead and go to the next slide.
Okay.
So then one of the next questions that also comes like, well, I don't feel comfortable getting this because this feels like this went way too fast. Did our government push on there? Did we skip some steps? How do we know that this is safe? So I want to point out that none of the steps were skipped during the clinical trial in the process. What they were due is they were given extra emphasis and attention to make sure that they were done in a timely fashion. So to go back, how do they approve a vaccine? It has to go through multiple steps, and we call these steps phases before they get approved. So once a company is ready, then they can test it on subjects. So this messenger RNA technology has been around for over a decade. We just haven't used it specifically for vaccines. So once they were able to identify the actual virus, then they were able to plug it into technology we already had, which was this messenger RNA, and use that. So what happens in phase 1 is they just have a small number of people, like in the tens of people, less than 100. And the point of that is to test and say, is this vaccine safe? Once they're able to do that and prove that it's safe and not have any adverse concerns, they can go on to phase 2. Phase 2 is where they use hundreds of people, and then they are able to test it. Not only is it safe, but is it effective? Does it work? And they're able to spread out the type of people that are involved to include more groups of people that we might not have caught in phase 1. And then phase 3, they use thousands. In the case of the Pfizer vaccine that was approved last week, 44,000 people were involved in that. So they able to include different races, different age groups, different illnesses that these people might have had to be able to decide, is this vaccine both effective and is it safe? And so that vaccine was approved last week on December 10th from Pfizer. And there's another vaccine from Moderna that is going to go through the same FDA approval process tomorrow, which will add, again, another set of vaccine supply that we're able to have. So they went through all of these phases, just as any vaccine should. But what was done differently is during the process and the phases, the government, with this warp speed, was able to fund the drug companies to already start manufacturing the vaccine back at the beginning parts of the phases when it looked like it has promise. So multiple drug companies were given finances to be able to produce their vaccine while the phases were going on, so that when they did get approval, at the end, they would already be ready to go. And I compare that to the Super Bowl. So when you watch the Super Bowl at the end of the game, immediately when the game's over, you'll see the winning team put on their hats that say world champion football, or they have t-shirts already to go. And so when they already have that, that's because they did it simultaneously. They did it while the season was still going. You can imagine the other team over there probably has boxes they left closed that also say they're the champion. And that's what's happened with some drug companies, that if they're producing it, but they're not passing these phase trials, those are just going to go away. And normally drug companies can't afford to do this, a very expensive process to do, but the government was able to step in and finance that to have that happen. So the other thing that made this easier is that in other vaccines, we might have had to wait years for those test subjects to become exposed to this virus. But because our numbers were so high, we had it all around us. And so we were able to get those numbers in a much more rapid fashion than we were anticipating. But this fall and this winter, with the surge that we had, we were able to meet the numbers that they needed. So go ahead and go to the next slide.
Okay.
So, and this just kind of sums up what I've just said. I wanted to bring up two extra things. What do you see after you get the shot? So you might see some initial, what we'll call side effects. And that effect is going to happen the day of to maybe day 2, maybe day 3, where you might have a sore arm or a headache or fever, fatigue. And that's going to happen initially. Not everybody, but some people are going to get that. And then that should go away in that first 1 to 3 days. Then there are other things, adverse events. And I think this is what attracts more people and to really be concerned about it, saying, what is the long-term effect down the road? And what they have found in the past with vaccine, that if you're going to see any of these adverse effects, you're going to see them in that first 6 to 8 weeks. So by 2 months, you can anticipate if you're going to see an adverse event from a vaccine, it's going to be in that time period. And our phase 2 and 3 trials are beyond that 2 months period already. So we're a ways out. And as time goes on, those vaccine safety checks are still going to be in process. And it's going to continue to look back at that groups as they extend the vaccine to more different geographic areas and different patient panels of who is able to get that. So that is going to get more information as time goes on, and we'll just have to wait for that. So that's my little blurb for today. And if there are any questions, we can go to them. Otherwise, I can use my list.
Well, no. So I had people put in questions, and
Perfect.
I think you talked a lot about that. And I'd love, because I think this project was actually called Operation Warp Speed, wasn't it? By the government. I love that. That's it. Just looking as fast as we could, since in our lifetime, we haven't really experienced anything quite like this before. Did you have any questions you wanted to address today? Otherwise, I'll just have people keep collecting them for Friday.
Okay, so the questions that I hear over time is, one, is this going to change my DNA? Is this going to affect fertility? Is this going to affect, and from my explanation of the mRNA, it doesn't get in there and affect it, but we have no reason to believe that. We have no evidence to show that that would be even possible physiologically speaking. So that is not a concern that we have regarding that.
Okay. Awesome. Okay. Well, this was amazing, Dr. Nace. Thank you so much. You are clearly a pro at giving this presentation. So tomorrow, Dr. Nace is going to come back right after you got your vaccine, right? This is very like a chronicle. Yes.
So maybe let me address this. Yes, tomorrow I am going to get the vaccine, and then we'll talk about that again tomorrow. That there's the question of like, how do they decide who gets it? And so that is an incredibly complex question. So we get our guidance from federal, and then from state decides, and then local, and then within the local figuring that out. And so right now we just know the first line people who are getting it now, which is the people who are working at the hospital, who are straight on, or who have direct patient care phrasing that have a higher risk of exposure, as well as those people in long-term care facilities who work there and who are residents, because those are the really hardest hit areas. So we know that first part of it. We don't know all the other steps and how that's going to be done. So I am included in that only because I am in that front line working from the hospital.
Yeah.
So
okay.
Yes, tomorrow morning.
I'm so excited. So tomorrow we'll talk more about effectiveness and that process. And then on Friday, we'll have time for questions too. And we'll check in on Dr. Nace to see how she's feeling. Okay. Thank you so much, Dr. Nace. And
You're
thank you
welcome.
everybody for joining. And we'll see you, as Batman would say, same bat time, same bat channel tomorrow. So thank you guys. We'll see you tomorrow.
Thank you.